Vivian is a passionate advocate for the LGBTQ+AAMHP community. She started out at La Fuente as a recovery tech with the support of her La Fuente family and completion of her education. Vivian worked her way up to case management counselor. She shows her passion for helping clients take care of their outside needs while in treatment so they can focus on their recovery. Vivian also leads several groups in the La Fuente program. Vivian's goal is to continue her education and further her career by becoming an LMFT and carry on helping the LGBTQIA community at La Fuente Hollywood treatment centers. That may be a dated bio, but I hope it sounds like we were getting ready. Please join me in welcoming.
Thank you so much. It's such a pleasure to be here. I love education, and just to update a little bit of that bio, I'm the newly appointed IOP program manager now at La Fuente Hollywood Treatment Center, as well as a current student enrolled at Antioch University. So today's topic, affirming transgender people while treating for substance use disorder in the treatment setting. It's so important that we're all seen, especially when we feel so unseen, right? When we're using, and also we're LGBTQ folks, or we're a marginalized community. And transgender people come with a lot of trauma from the medical field, right? So we're pathologized. The DSM-5, page 451, gender dysphoria, right? Talks about now centering on the dysphoria piece, right? And so the incongruency of gender expression and sex assigned at birth, assigned at birth, and rather than gender identity disorder, right? So that's old, that's out of there, and they changed the ICD language too, right? I like the word incongruent. I think it's just better. But we're so used to being pathologized, right? And so, what is that? The SOC, the WPATH, right? So we have to sit in front of mostly cis clinicians that tell us that, we're trans enough to receive the care that we need. And so when we come into a treatment setting, we come in with that trauma, right? And it is trauma, Think about it, where I have to sit in front of somebody and convince them that, I'm a woman. Take that in a little bit, right? So and that still happens, that still happens. It still happens. I just ran across that not too long ago. I'm 46 years old. I transitioned at 19, and that still happens because of the SOC, the standard of care. And I think that, and I don't want to bash, the SOC. I think it's great. It's in place for a reason. But there is a lot of gatekeeping in that model, right? And then we have the other model, which is the informed consent model. And so that's what we hear, right? We hear gatekeeping a lot. And so now we're getting treated for substance use disorder. And so we come with this mistrust, right? Even in our own community, it doesn't matter, cis people, we just come with this mistrust and trauma. And so it makes it a little more difficult for the transgender patient that comes in, or client that comes into the setting, to gain that trust, right? For me as well, right? And as a transgender woman, it becomes a little like, I have to remember clinician, safety of the client. So the affirming piece, hi, my name is Vivian. My pronouns are she, her. May I ask what yours are? And so, it opens up that safety and comfortability for the client. May I, right, ask what your pronouns are, and then it helps the client feel safe in the conversation. It opens up, my pronouns are, and I think that's where the trust can start, right? And just listening and hearing what a trans person has to say about the trauma that they've come in with, right? Because we use, for so many different reasons, right? And dysphoria is a big piece of our using, and also too that there is a divide that we feel as transgender people within our own community, right? Sometimes the T is silent. And then we step into a treatment center that is LGBTQ plus, right? Whether affirming or exclusive. And we're surrounded by other queer people, right? And they all come with their own, trauma, right? And so then we get the intrusive questions, right, from other clients, and I've seen it many times in the field. I'll have a trans male client come up to me and saying, this person is asking me, how I have sex, or this person is asking me about my body parts, or this person is asking me, if I'm a boy or a girl, and so, it gets so difficult in those moments, right? Because again, we're dealing with clients that come in, to get treatment, to get help for their substance use, right? And then having to, hear those things too. But then we also have clients that haven't really been around, their queer community, whether they were isolating or whether they were, experiencing any internalized stuff about their own sexuality or identity. So, how do we handle that gracefully, right? Like I always think it's important to lend any education to anyone who would like to receive it. And that's how I open up that, like in groups or spaces. For me, I'm all about it. Like, ask me questions. Let's come from an educated POV though, right? Because I'm not going to be talking about my body parts. It's not going to happen, right? So, but ask me some educated questions. Like, I'm here for it, right? I love to educate people, on gender identity and dysphoria, and the appropriate way to address a trans person, because it's all about a safety for all of our clients when we're in the spaces, right? We're holding space for these folks, and it's all about safety first, and acknowledgement, and affirming, and usually it just opens up that conversation, and whatever group it was, can turn into a little bit more of an education, and it's always really appreciated, and then, I think it's important too, because then we take the responsibility more of the educating rather than the person who's in there, receiving the treatment. Because I hear this a lot as well too from the trans client. Like, I don't want to educate. Like, I'm so tired of educating people. Like, I don't want to, right? And so at this point, for me, it's important to ask the client, is it okay if I do? I would like to, but I don't want you to feel, it's my codependency. What I want to make sure is that, this is about education, in terms of trans folks, and not pointing you out, like not point, but sometimes if it's the only trans person besides myself in the room, that's a difficult dance, right? So you really have to find the correct words, like, and so it's important, I think it just provides more safety, it provides more trust, and for everybody around, and, it's and the education piece, I can't stress the education piece enough, because it's just so important when people leave to the treatment center, right? And they're interacting and they hear these words, and there's a word that I hear a lot that gets thrown around that I think our community is trying to take back, the trans community, the young trans community, not the older trans community, because, they can keep that word, and I hear it, and I've heard it, from cis gay men, I've heard it from cis gay women, and it's just a derogatory slur word. And so educating people on that stuff is important. Yeah, so I mean, it's a lot. I'm gonna keep going if that's okay with everybody. So just making sure that we're affirming, and also, too, like when we're around each other, right? And somebody's having, difficulty with pronouns, we can correct, right? We can correct. I think I love to be corrected, and sometimes I will have a difficulty, right? Because when I first came back into the community after 20 years of being out of the community because of this divide, I had never met a non-binary person before. So I'm like, what is that? Like, I don't understand what that is, right? And then somebody said, well, first of all, you shouldn't say that. Here's this correction and that correction. I'm like, oh, and then to get them more education about, like, non-binary people are folks under the trans umbrella, right? And then understanding more of what that meant as a transgender woman. And, oh, okay, and just struggling with pronouns, right? They and them was very new for me. And so the first name was always the go-to, and that was really helpful when I was first learning more about non-binary folks. Just use the first name. Like, just you'll get used to it, right? It's a new thing. You'll get used to it. And yeah, now I mean it rolls off the tongue. They them. Okay. In the notes, they them. They them there, honey. And so, like, it just rolls off now, and, like, I'm okay. I got it. But you also hear from older LGBTQ folks, well, I'm not doing that. I'm not doing that. I'm not going to try. You look like a female to me. You look like a male to me. And so how do you handle that in the treatment setting? Like, how do you handle that as a clinician in the treatment setting when that happens, right? Because sometimes, for me, as an older trans woman, that transference wants to come out, because I think about, like, those old days in the 90s, that divide. Excuse me for just 1 minute. And so I have to push that aside and remember that, things are different in 2022. And then, you're not willing to be, are you willing to be educated? That's the first question for me. Are you willing to be educated? And then, no, I don't want to be educated. Okay. We're good then. Okay, so call them by their name. Have that. Do that. Can you do that? Because it's respect, right? We always be called by our names. And usually that, presenting it that way, really helps. And then, you know what? There's an open up. And it happens down the line, right? There's an open up. And usually it doesn't have to do with, like, a person that's unwilling. It just has to do with them not feeling comfortable around their own community because of whatever reasons, or how they were using when they were out there, and how they had separated, and how they don't know too much about their own community, and so now they're feeling these these feelings coming up for them, these feelings that come up for everybody when they come into a treatment setting. Usually it has more to do with them rather than the person. And so we can even ask them if they would like to talk more about what feelings are coming up for them when this is happening. Like, let's take the content out of this. Like, what feelings are coming up for you when you're presented, with a non-binary person or pronouns that are different than yours? What is that? What feelings? So, yeah, that's been my experience. But yeah, there's a lot that I've covered. There's a lot that I've covered, but I wanted to talk to also about a piece that comes up a lot in the treatment setting, and that's trans folks who are very new in transition, right? Who or have a plan to I want to transition right after I leave rehab, or I want to transition while I'm here. Do you do that? Usually the answer is no, we don't do that. We're here to help you treat, your substance use disorder, and, yeah, definitely, that's wonderful, but it's so hard, I think, for me as a trans woman and a clinician, because that question comes up a lot, and that and because I'm sitting in front of a trans person, and I get to talk to some incoming trans people and do one-on-ones based on gender dysphoria, and navigating dysphoria as a sober person, as a sober trans person now. This our dysphoria comes up, it's full force when we get sober, especially in early recovery. It's left and right, and so that's the most prominent thing. That we were numbing it, we were pushing it away, we were drowning it, and now we're just so uncomfortable in group settings. We're uncomfortable at meetings. We're uncomfortable looking in mirrors. We're uncomfortable in our bodies. We're just so uncomfortable. Imagine just sitting and just not liking yourself. Just everything about you. You're just picking apart. Or you think that everyone around you can see that other gender. And it's really sad to see that in other trans folks, and I can spot it from a mile away. This is where affirming really, really helps. Correct pronouns. Any clothing. I love that that the Trans Wellness Center is going to be receiving they really need it, clothing that is going to be probably put in their closet, which is called the closet, that trans people can come and get these free items, these gender affirming items, and we have taken clients there to get some gender affirming items. And that's the thing too, just supporting those things means so much to the client coming in. So I love it. That's another way we can affirm these clients that, the transgender clients that come in. But also, back to the early transition piece, and clients wanting to start hormone replacement therapy or any other transitional therapy. It's important to just, affirm it and let them know you hear it, and also let's help you with your substance use disorder, and when that's stable. You can do anything. You can do anything. Because what happens too is just trans people come into the setting, and they're pausing, right? Like we all pause when we get treatment. You hear a lot of that, right? With clients, I paused, my life is paused. I paused my life, my growth and all of it. We're pausing our transition. We're pausing, we're pausing it. Like we're just, it's halted and we're drowning feelings and all that. And, so they're in a rush, right? We want to get to it. Like, just like everybody who comes into a treatment they want to fix the wreckage of their past very quickly. So, that's what I can compare it to. Like, we want to get back on track. We get our hormones, we want to, we get affirming surgeries and all of this. There's been so many instances. I'm thinking about a case study in mind about a young trans person who wanted to start HRT right after residential, went into sober living and IOP, and then started and struggled. Because think about it. You're all like, yeah, because right? So this is all, healing, right? We're getting on correct medication now for, any underlying mental health or mental disorder, like any bipolar, anxiety, depression, anything that's coming up, right? So this is all stabilizing. And then you're going to throw in hormones, right? And female hormones. Ooh. It was just like recipe. And, and then I'm like, and so it was hard. It was hard as a clinician just to sit there and just be like, this is happening. So like, how are we gonna, what are we gonna do? Like, I don't want to gatekeep. 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 So, and anyways, this particular case, that this person, struggled, and then down the line ended up relapsing and is back in a setting. So that's just one case study. Another after leaving residential, affirming, top surgery, opioid addict, relapse on opioids. So but here's the thing, that the trans client will not hear you. So you cannot stop them. Right? That's tough. That's tough, honey. It's tough. And so just continue to affirm. Okay. It's so hard. It's so hard, right? Because what I want to say is, the WPATH, that's there for a reason, and here's the reason why, right? What does it say in the WPATH? It says, make sure that any underlying mental health issue is stabilized before any affirming type of treatment, surgery, hormone replacement, any of that, right? But what they hear is gatekeeping, and I get it. Somebody is holding the key to my identity, my gender identity. Like, how dare you? Like, and you're horrible, and just, that's all, right? So it gets tough as clinicians because we want to help. We want to help. We want to help, and then it's just like explaining, like, hormone replacement therapy, that's like a second puberty. Think about when you went through puberty and how fucking awful that was. And here is just like, there's so many things going on, and, you're stabilizing, some of these disorders, either depression, bipolar, 1, 2, whatever, was attached, because of course we self-medicate, so we're stabilizing those, and that takes some time, right? Medication takes time to start to work again. And then you're going to put in a second puberty. So does that sound like a walk in Disneyland to you? Because I don't know, but they the client won't hear that. The client, especially, the trans client. So what we do is we just do our best to affirm and help in the areas that we can help, and at least that's what I do. And yeah, as a trans person myself, it gets a little tough. Because I'm all about safety, right? We're all about safety, the safety of the client, and sometimes I will say it one time and that's it. I will not keep on saying it. Hopefully you hear it. I'm going to say it once and that's it, because then it does become, gatekeeping. I wanted to open up any like Q&A or thoughts about anything that you've heard, or yeah, anyone. Yeah.
Hi.
Hi.
David.
Hi, David.
Thank you, first of all, for coming and doing this. Also, sharing your lived experience as a trans person, because I think it's one thing to have a clinician talk about the issue that it doesn't have that same lived experience, and it's another person hearing their own perspective as a trans person dealing with clients that are also trans, but not necessarily the same pronouns as you. Like, that was really cool to hear that dynamic and all these things. Because I went to Manny's thing and I heard there was some conference a few years ago, I guess before COVID, and it was 2 hours of 150 different ways to identify, and I took it in, but hearing the direct thing that you just that was super helpful for me as a cis gay man. So, and I have a not oddly, whatever. I have a recovery home that's social model driven, 12-step abstinence long term, but it's not specifically LGBT. I'm the guru of LGBT issues in our house because it's primarily not LGBT. And and we have a contract with West Hollywood, and we get calls occasionally from trans people, that want to come in the house, and it's a gender specific men's house. Do you know what I mean? And we're about to open a gender specific women's house. But we would of course take people that were trans if they wanted to be in one or the other house, but it is a gender specific environment. So it's really, like you said, in terms of pronouns and how I don't know how we would deal with a non-binary person. This just hasn't happened in the 6 years we've been open. But I would just be curious, what you think would be best practice in terms of how to handle that. I've gotten 2 phone calls in 6 years from trans people asking about becoming a resident, but probably because we're not LGBT specific. But I would just be curious from your perspective, what you think would be the best way to handle that, both in the gender specific women's house and the gender specific men's house.
Yeah, I think that's a great question. For the non-binary person, affirming, right? Affirming pronouns, affirming, and asking them. I understand what non-binary is. Means. Excuse me. I understand what non-binary what non-binary means, and I just wanted to ask you where you would feel comfortable.
So put it more on them, is what you're saying.
Yeah, ask them. Yeah, I think it's just it. I think it opens up safety. It opens up and it affirms them and their identity.
And same with if they were trans.
Well, I think again. I go back to the pronouns, right? May I ask what are your pronouns? You're a trans person who identifies as female will say she, her. A trans person who identifies as male will say he, him, and there's your answer.
Because it's not a clinical environment, so it's a family living environment. So they're living dorm style in rooms with 2 to 6 people.
Yeah,
and so it's from your perspective, what I think I hear you saying is that you're saying leave it up to them as whether that's an environment they would be comfortable in.
Yeah,
and specific about what the environment is.
Yeah, and I think when you from my experience, when you put it that way, or when you explain to them, the how the community living is set up,
Right.
most trans people will tell you that they don't feel safe, or they won't feel safe.
Because
Most-
I would make sure that it was safe for them,
Oh yeah, no matter
But-
what though.
regardless of whether they feel safe, which I guess are two different things.
Yes, yes, yes,
You know,
yes.
but
Yeah.
it would be. I mean, I'd be honest. Like, it would be challenging. Do you know what I mean? Like,
Yeah.
For everybody, the staff, the alumni, the residents in the house. Like, I recognize that. You know, it's challenging even when we have like a cis gay man or a cis bisexual man in the house. Like it brings up. I love that it brings up all those kinds of things in the house, and we talk about it openly. But it's yeah, and I welcome that challenge. It just hasn't come up yet. So I just wanted to hear from a trans clinician's perspective, like how you would think of that.
Yeah, and I hear you provide safety, for the space. That's what I hear, and there will be some trans folks who are like, yeah, I don't mind, and then it goes on to, the residents that are there. Are they open to education? Are they open-minded, right? And so like that's the something that you have to bring into the space, right? Like you have do you have any educational type of conversations or group meetings in regards to gender identity and that what if scenario, right? So if you're providing a safe space, then that type of education, those type of those educational conversations, I would think about bringing in.
And I just have one more follow-up question about body parts. Because when we were bidding for the contract with West Hollywood, that was not an issue for us. It was more how somebody identified.
Right.
There was another, which I won't name, recovery home that was gender specific for women, and they said if the body part wasn't female, they wouldn't take them because there was a bunch of clinical reasons why they said they didn't want to take them. I didn't agree with that, but I just would be curious what your perspective is on that.
Yeah, I think it's sad. Yeah, I think it's sad.
That's how I felt.
It's really hard to place trans people. I don't know if any of you have experienced that in sober living homes. It's very hard. That's so sad. It's so sad to me. When I first started case management work, I ran into it, and I still run into it. It's very hard, and it's very sad. And I want to say I get it, but I don't. I don't get it. No, I don't.
I don't either.
Yeah. And I understand that everybody needs to feel safe. I understand that.
Yeah.
But I also I don't think that placing a preoperative transgender woman in an all-female home would raise a safety concern. I just don't. Don't we all use private bathrooms? So, yeah, that's what
Thank you for that.
Yeah, thank you. Mm-hmm.
Hey, I'm Andrew Saunders. I'm a therapist in private practice, but I've worked in a number of clinical settings with a number of people in this room. And I've...
We're using the mic.
Oh, thanks. Hello, does that work?
Yes.
Oh, wonderful. Hi, I'm Andrew Saunders. I'm a therapist in private practice here in LA. Having worked in different clinical settings over the last 10 years, I have had situations, and I'm curious, as a clinical director yourself, how you approach it from a programming standpoint. Because, of course, old school, we had gender-specific process groups, we had gender-specific all sorts of things. how do you address it as more and more trans people are coming into the general population? But we're still in situations where in a small rehab, you might have one trans person. And especially in substance abuse, where we're trying to teach people to live as people on people's terms and not being exceptions, it brings up the issue of exceptionalism when someone's like, well, I'm trans and I need to have a group for trans people. Or it's like, how do you address it? But from the clinical standpoint, it must be a headache and a half.
Yeah, sometimes. Yeah. Because we're all terminally unique when we first come into treatment.
Right.
Yeah.
So I'm really curious how you approach it with 25 years experience as a person who's made a transition. And all of the compassion that must come with that, but also with all of your clinical expertise.
Yeah, thank you. Thank you. Thank you for the question. Again, affirmation and safety is so important, and hearing the client and what do you think's missing? That's what I say. What do you think's missing? How can I invite the client into the dialogue? Like, tell me, how can I do better? How can I do better? Because I'm all about growing. I love it. Give me the feedback. Like, how can I do better? You tell me. Because sometimes you'll get that, right, where there will be the only trans person in the room, and I've heard it. And just an example. A trans male client, right? He is in a room full of cis gay men. Well, I don't feel comfortable. Like, well, can you tell me why you don't feel comfortable? Well, I just don't feel comfortable around cis gay men. And I'm like, okay, all right, cool. I get that. I didn't feel comfortable around cis women for a long time. And now my home group, is women. I love women. I think what happens, and just kind of affirming that, right? And like, let's talk about why that is. Like, let's talk about why that is, because guess what? In life, when we get back into the ocean, right? RTC, pond, lake, sober living, IOP, and then ocean, right? When we get back into the ocean, guess what's going to be around? Lots of cis people. Let's talk about where that comes from. Let's unbox it together. Like, let's talk about it. Like, bring them into the dialogue. Motivational interviewing. You be part of the. You evoke the positive change talk, right? Like. Sharing a little bit of my own experience with that helps, right? And just, for me personally, as another clinician, I've heard at this conference I was in from this trans woman talk about that, and I told, here's this experience that I heard, and yeah, because we come with some trauma in that too, right? So we open up and to our cis friends, and then we're all drinking or whatever, and guy hits on girl, and girl's like, she used to be a guy, and so we get outed, right? So we feel unsafe, or you get the trans client who's isolated, right? Transitioned in isolation, pulling away from family. And then you're in your community, or they were in their community and they feel that divide, or they don't feel accepted, by cis gay men, or they're identifying as gay men themselves, right? And maybe that's not out there on the table yet, but I've had that happen. I've seen it happen, and just. That all of it, so there's so much that comes with it, right? And so just inviting the client into the dialogue, I think is important, and also reminding them, here's the underline. We are all we are all in a marginalized community, LGBTQ+, right? I understand and honor the fact that how you're feeling right now, and how you cannot relate to a cis gay man or how you cannot relate to a cis gay woman, do your best to relate to the alphabet, honey.
Mm-hmm.
That's it. Because we are all marginalized. We know what it's like not to be or feel accepted.
Yeah.
You know, I understand for sure that we come with different types of marginalization within our community, right? I mean, a trans person can't, who feels unpassable or whatever, it's a problematic term as well, walks around and gets talked down to, or gets shamed or called out or whispered about or, all of it, and a cis person, goes out there, a cis gay man or a cis gay woman, that uncomfortability is still there, right? But what a trans person will say was, would say is, a cis gay man can act straight. I can't relate to that, Sure you can. Let's talk about how you can, So I think just bringing them into the dialogue.
Fascinating. Mm-hmm. Thank you.
I follow from no matter what. We are heavy in our trans census, our trans population census, and one of the barriers that I think we have is I don't want to use the word transphobia between the community. That might not be the right terminology, but there's definitely a competitive kind of nature with our trans clients that we have right now.
Mm-hmm.
For me, it was internalized homophobia, and one of the things that I really had to do a lot of work on through my own recovery journey. But there is definitely this. I don't want to use the word competition, but the trans clients are not necessarily the nicest to each other in a capacity when they're all kind of together as well. So really trying to navigate that experience for the trans clients and making sure that they're safe and heard is one of the barriers that we are kind of running into.
Right.
Or if we have a trans person that is from a different age demographic than our younger trans people, there's definitely a barrier in treatment that we're trying to navigate with that as well.
Right. Yeah, and that's such a great example of the generational divide, right there, right? Because I'm a 90s, transition person, and and then the younger, right? They're very younger folks are very I don't want to say passionate. The younger trans folks are very passionate. You don't know my struggle. I think it's important to listen. I think it's a matter of you can learn from an older trans person and bringing that education in too, as well as listen to, they help pave the way. Right. And so just bringing in that the education and respect aspect as well, but also some of the toxic behavior between trans clients, it spills out from, right, the streets, right? Because most trans folks that are using, right, survival sex work. And so with that comes a lot of toxic, competition-y type of behaviors, and now we have that in nightlife clubby stuff going on with the younger generation too, and influencers and the the Facebook following crap. Stuff, and all of that. So it's all that competition. And so it's all about remembering that that's an old behavior. Right, and then talking to them about old behavior versus new behavior, and I'm assuming that there's some 12-step too in there as well. And just what step are you on, by the way? Can't wait till you get through that 4th step. So it's all about hey, you don't have to do that anymore. you're in a space where you get to uplift other trans women. Like, you're in a space where you get to uplift your trans community now. Like, you're in this space that's safe for everybody. And I understand that you felt unsafe out there in the world, right? For probably so many reasons. Now you're in a place where you can feel safe, and like, how can we help you feel more safe so that you don't have to engage in this type of behavior? And it is toxic behavior for sure, and I've seen it, and it is hard to manage, but
So it's not uncommon.
no. So just reiterating safety. I mean, like, just think about where it comes from. It's survival. And what I heard, one thing that I really related to in early recovery was when somebody says, like, I understand that you did all that, and I understand that you had to survive out there. I understand that. I think survival skills are amazing. I think they're great. Sometimes you can't learn a survival skill, right? Like, you go through some stuff, right? So we don't want to take away your superpowers, honey. We just want to help you use them for good. That's what we want to do. So how can we help you use those superpowers now for good? To uplift rather than put down, because it isn't a competition. And I love that you brought that up too, because there's so many like trans folks that come in, transnormativity, we hear about that, right? You're not trans enough because you haven't had this affirming surgery or that affirming surgery or the bottom surgery or whatever, right? That's transnormativity, right? And I remember when I first came into the treatment setting and I would meet other trans folks, right? And I was one of those trans folks that was like, well, you don't look like me, right? What does that mean? Mm-hmm. What does that mean? That had to do more with me and my internalized stuff, right? And when other trans people come in and they have that, right? That's more to do with something internally that's going on. And but being able to, again, being open to being educated is so key, and it really helped me grow in terms of like, not all trans women have to look like one another. Not all trans men have to look like one another. Sexual orientation is different than sexual identity, as well. There's so much of that shaming in the trans community of like, sexuality shaming. It's problematic, right? And so it's just like, just remembering like education, and I mean, I feel lucky sometimes because I can come from like personal experience. I'm like, well, this is how I felt, but like, just education and just, I think it's important, in those situations as well too, is just, it's going to be okay. You're growing, we're here to help you. We're here to help you through this. We're here to help you grow and feel more safe around your own community, just within yourself. And like, we're here to support, the behavior though is not okay. So let's help you through that. Let's help you through that, because it's not a competition. It's not a competition. You're in a sober living house, and you're fighting for your life. You're fighting for your life. That's a reminder. So do you want to get educated and grow, or do you want to stay in this old behavior that has helped you out there, right? You can pick.
I'm so grateful for you and God, just being a major voice. This is definitely a conversation that we'll have to continue. I'll never forget. I had a clinician that was pretty amazing, and community was really just, egos were coming out, everything else, and like a competition vibe. And I'll never forget, he had everybody say, let's all go outside. And if you can imagine LGBTQ, everything, a variety, right? A whole bowl of fruit for sure. And it was pretty, he says, I want everybody to line up. And so we're all standing out there. And he says, now, everybody that has dealt with some type of shame, step forward. Take one step forward. And did the whole, really breaking down the deep core emotions that brought us into needing recovery. And it was such a huge visual. I could tell you at the end of that, everybody went around and gave each other hugs. And everybody was now ready to do the recovery. Because they were all there as a community, and they were kind of, whatever was happening, they saw that they were all dealing with some sort of pain or trauma or which have you, regardless how they identified or whatever. It was pretty amazing. And I'll never forget that, because it was so powerful. And I thank you so much for being here. And yes.